do you mean by they don't necessarily respond well?
The obsessions does not change much, and the compulsions really stay pretty much the same. And if we look at it from an hourly point of view, if they say they're doing something for 10 hours a day, it won't change. I always say, well, how long are you spending on this particular task? And I get that as a baseline. They say 10 hours a day or 12 hours a day. 6 months later, I want it to go down to at least 1 or 2 hours a day, none at all. But most people don't eliminate it, but I just want to get it down some that it's where it's manageable.
Okay. How should employers and even family members treat a person who they see is possibly just going a little bit too far in these behaviors that we're talking about, obsessive compulsive behaviors?
And just be lovingly kind and lovingly insist on treatment, because it can be highly embarrassing. There are a lot of patients with OCD develop social phobia because they don't want anybody to know what they're going through. So too much attention can actually make them worse. Just enough attention to let them know you love them and care about them, and therefore they can get help and get better.
Okay. All right. Are there certain people that seem to have more of a susceptibility to these obsessive compulsive behaviors?
Single people and the Caucasian race and have a little bit higher percentage of OCD.
Is there a reason why?
We really don't know. Now, as far as the sexes, it's common with male and females, and children it's more common in boys.
You say it's more common with males than females?
Only in boys, but in adults it's the same.
Okay.
We really don't know why it's like that. We just know that's the way it is.
Okay. And most of this may start in childhood, doesn't it? A
lot of it started in childhood. Most patients develop symptoms actually before 20. It's very rare after 35, only 15% after 35. So it's a condition of the young.
Okay, so we know that young people, oftentimes children may go through some level of trauma. And according to what you're saying here is that there may be some traumatic experiences that they may have in their young life that will, this is the result of it.
It can be. There are actually some studies now that's linking even streptococcal infections to OCD later in life. Most children get strep infections. Now we think there's some link between strep infections and OCD.
Wow.
Or post-viral syndromes and OCD now.
Okay, so how is it usually detected in perhaps the classroom?
Just excessive, repetitive behaviors. And the teacher may send a note home and saying it took the student so long to complete a task. All right, he just lost focus, somewhat similar to ADHD, but it's more of a driven quality to move instead of getting up out of their seat. That's why we say compulsions. It's a desire to do something. It's not well under voluntary control. They really can't control it.
But there are some who really feel like they have this compulsion to want to be perfect. And they become, perfectionists, and that's another thing that is driving a lot of people as well.
It can be. We sort of get into obsessive compulsive personality disorder at that point, which is a little bit different than OCD.
Okay.
The personality disorder do have a drive to be perfectionistic.
Okay. Well, if people want more information and would like to contact you to find out more, how would they contact you?
They can just call my office at 334-280-3230.
All right. So there may be a loved one that they're very concerned about, and they can give you a call and find out more. Maybe that's what it is, and maybe it's something totally different. Thank you so much for being with us, Dr. Palmer.
All right. Thanks for having me.
All right. It's good to have you with us on the program today. Thank you for joining us. There's more to come on Join Our Town, so stay with us right after this.